Massage therapists and body workers. Quick question. Think about the clients you've worked with in the last month. How many of them mentioned knee pain, a stiff knee, an old sport injury, arthritis, something that just hasn't felt right in years? My guess? Quite a few. Now here's a follow-up question. When they mentioned it to you, what did you do with it? Did you have a real system for it? A full set of techniques, a clear treatment protocol, the confidence to say, yes, I can work on that specifically? Or did you kind of work around it? Do a bit of compression, maybe stretch and move on. If it's a second one, you're not alone. And today we want to talk about why that is, what it's costing you, and what you can do about it. Here's something that might surprise you. The knee is one of the most commonly neglected areas in massage therapy. Think about that. Knee problems are everywhere. Sports injuries from running, soccer, dancing, arthritis, worn down cartilage, inflammation, the stress of carrying extra weight year after year, the cumulative damage from bad posture and the wrong shoes. The knee takes a beating throughout a person's life, and yet in most massage modalities, including Thai massage, the knee is either skipped entirely or treated as an afterthought. Now, why does that happen? Because most massage therapists are generalists, and there's nothing wrong with being a generalist. A good full body massage is genuinely valuable. But when it comes to the knee specifically, a generalist approach just doesn't cut it. You need a different level of skill, a much larger repertoire of techniques, and a clear strategy for how to actually address what's going on. Most massage schools don't teach that. Most training programs glosses over it. And so therapists end up with a standard routine and no real tools for one of the areas so many clients desperately need help with. Now let's talk about what this means for your practice specifically, because this isn't just a technique gap, it's a business gap. When a client comes to you with a knee problem and you don't have specialized skill to address it, one of the two things happen. Either they don't mention it and they leave without the help they actually needed, or they mention it and you do your best and they quietly go looking for someone else who can really work on it. Either way, you've missed on an opportunity, not just to help that person, but to become the therapist they tell everyone about. Here's the thing about specialization. When you become known for being able to solve a specific problem, really solve it, not just give someone a nice relaxation session, the word of mouth is completely different. Clients don't describe you as a good massage therapist. They describe you as a person who fixed my knee. That's a different category entirely. That's reputation you can't buy. And knee problems are not rare. They are everywhere. Athletes, older clients, people recovering from injury, people who've been told by their doctors that there's nothing to be done. These people are actively looking for someone who knows what they're doing. And right now, very few therapists can actually say that. So why are we talking about this specifically from a Thai massage perspective? Because Thai massage approaches the knee in a fundamentally different way than most other modalities. Most massage approaches look at the knee as an isolated area, something to compress and release. Thai massage looks at it as part of an entire energetic and structural system. The whole leg, the energy flow through the sen lines, the relationship between the hip, the knee, and the ankle. When you work on the knee the Thai way, you're not just poking at the problem area. You're improving, balancing, and energizing the entire leg. And that creates a condition for the body to actually heal itself. And the techniques themselves are completely different from what most therapists have in their toolkit. We're talking about compression, stretching, traction, rocking, circling, an entire range of approaches that work from multiple directions on the knee joint and the surrounding tissue. There's also the body mechanics side of it. When you're working on a large client's legs with just your thumbs and hands, you tire quickly. Thai massage gives you options: forearms, elbows, knees, feet, body weight doing the work instead of your joints. More power, less effort, and no risk to your hands. The result is a system that is more thorough, more effective, and actually sustainable for you as a therapist. Now let's talk about what it actually looks like when this is done well. Imagine a client comes to you. They've had a nagging knee problem for weeks. They've tried a few things. Nothing has really helped them. A friend recommends you specifically because they know you work on knees. You don't just do a general leg massage and hope for the best. You have a clear treatment protocol. You understand the anatomy, the likely causes, the appropriate techniques for what you're seeing. You move through a full knee therapy session with confidence. Compression along the energy lines, targeted stretching, traction work, rocking to release the joint. And at the end of the session, your client stands up, bends their knee, and looks at you with a kind of disbelief. That's not hypothetical. That's what our students report happening regularly after completing the Thai massage knee therapy training. One of our students, Alex, had clients coming back specifically requesting knee work after their first session. Professional soccer players were calling him after games to thank him. Clients with skiing injuries. People who'd been told there's nothing to be done. Another student of ours, Spike, used the techniques on a client who had twisted her knee at a dance class. And the client reported that the pain had completely gone after the session. This is what happens when you go from a generalist to a specialist. So if any of this resonates with you, if you've had clients with knee issues and felt like you didn't have the right tools, or if you've been thinking about how to differentiate your practice and build a reputation for something specific, this is worth paying attention to. At Thai Healing Massage Academy, we have a dedicated Thai massage knee therapy online training course. It was developed by our founder, Sharma Kern, who has been practicing and teaching Thai massage for over 20 years. The course gives you everything you need to go from generalist to knee therapy specialist. An overview of knee anatomy, the causes of common knee problems, dozens of proven techniques, and a complete treatment protocol, and a unique skill that you will not find anywhere else. It's a 5-video module, 2.5 hours of step-by-step training with permanent access to course manual, and direct access to us for any questions and support that you may have. And here's an important part. You don't need to already know Thai massage to take it. These techniques are demonstrated on a floor mat, but most of them can be adapted to table work as well. So whatever your current setup is, you can use these skills. The link is in the description below. So if you're a massage therapist or a body worker who wants to stop skipping the knee and start being the therapist clients specifically seek out, this is a course for you to take. Thanks for watching, and I'll see you in the next video.